Hello friends, I am Dr. Lokesh. So today we are going to discuss a case of an osteosarcoma, a kind of bone cancer in a young male at the shoulder joint. So the patient reached to us with a huge swelling in the shoulder and the patient having a history of the pain and swelling since 6 months. Previously, he was operated by someone else by arthroscopic surgery without any investigation, without any aim. And after the surgery, the tumor of the proximal humerus had been spread to the whole of the joint and the rotator cuff muscle. So in this case, we removed the whole shoulder girdle and still we saved the limb. And this is the function the patient achieved. We can see the whole shoulder had been resected, still the distal part of the arm and forearm and hand still saved, and patient able to use his elbow function and wrist and finger. But yes, after removing the shoulder girdle, his shoulder movement have been sacrificed. But the whole of the tumor had been removed and still distal limb function preserved.
The patient had already been received the neoadjuvant chemotherapy. Before the diagnosis, patient underwent a shoulder arthroscopy. So the tumor had been contaminated the shoulder joint and half of the scapula.
In this MRI, we can see the size of tumor is huge and the white part is the tumor, which we can see the contaminated the whole shoulder joint, all rotator cuff muscles and the half of scapula. In this picture, we can see there are 6 types of surgeries which we can do around the shoulder joint. And the type 6 surgery is the most extensive type of surgery in which we remove the complete scapula, shoulder joint and the proximal part of the humerus en bloc without opening any shoulder joint. So this surgery, after removing this, we reconstruct the shoulder joint with the endoprosthesis. In this picture, we can see the post-operative X-ray after surgery, and we can see a metal endoprosthetic implant in place of the proximal humerus, and this implant had been put to maintain the length of the arm, not for the gaining the shoulder function. This implant had been hung via Prolene mesh and attached proximally to the remaining clavicle. This is the post-operative function after 3 months of the surgery, and we can see the patient able to move his arm, and we can see the patient is able to move his elbow, wrist and the hand. So by doing this surgery, we have preserved the function of the distal upper limb, but we sacrifice the shoulder function. See, because to gain something, we have to sacrifice something. There is no other way we can preserve the shoulder function, but tumor had been removed completely. Now his life is saved. Thank you.